Good day to everyone joining us and welcome to today's X-Talks webinar. Today's talk is entitled Oligonucleotides, a Bioanalytic CRO's Perspective on Current and Future State. My name is Aisha Rashid and I will be your X-Talks host for today. Today's webinar will run for approximately 60 minutes. This presentation includes a Q&A session with our speaker. This webinar is designed to be interactive and webinars work best when you're involved. So please feel free to submit questions and comments for our speaker throughout the presentation using the questions chat box, and we'll try to attend to your questions during the Q&A session. This chat box is located in the control panel on the right-hand side of your screen. If you require any assistance, please contact me at any time by sending a message using this chat panel. At this time, all participants are in listen-only mode. Please note that this event will be recorded and made available for streaming on xtalks.com. At this time, I'd like to thank Illyri Bioanalysis for putting together the content for this presentation. Illyri is a leading bioanalytical contract research organization with 3 sites in Colorado Springs, Colorado, Salt Lake City, Utah, and Luz, France. Illyri provides a range of bioanalytical lab, spatial bioanalysis, and spatial biology solutions to pharmaceutical companies for all stages of the drug development process. With industry-leading science and regulatory compliance, the team at Illyri helps pharma and biopharmaceutical companies advance their molecule from discovery through clinical development and NDA approval. Dr. Troy Boker is the Director of Laboratory Operations at Illyri in Salt Lake City, where he leads all of the lab divisions, including method development, method validation, instrument operations, and production groups. He obtained his PhD in synthetic organic chemistry and a postdoctorate in medicinal drug development and drug metabolism. He has been working in the bioanalytical industry for over 17 years and has developed assays for large and small molecules with extensive experience in both triple quadruples and high-resolution accurate mass platforms. He is the Illyri SME for oligonucleotide bioanalysis, in which he has led development and validation for this therapeutic class for the past 10 years. And now, without further ado, I'd like to pass over the mic to our speaker for today. Dr. Boker, you may begin when ready.
Thank you, Isha. As stated, today we're going to be talking about oligonucleotides and specifically a bioanalytical CRO perspective on the current and future state bioanalysis for this particular therapeutic. So obviously, you know, when you start these types of discussions, you want to kind of bring up what is an oligonucleotide. They are short, single or double-stranded DNA or RNA molecules. They usually consist of strands or mers of 20 to 50 oligonucleotide or nucleotide bases. Most commonly, they're around 20 to 22 in the therapeutic range. By manipulating the gene expression, oligonucleotides provide the opportunity to target disease at the molecular level and really have come on to be more of a cure rather than, you know, symptomatic treatment. Common types of oligos are ASOs, small interfering RNA, microRNA, aptamers, peptide conjugated PNA, and peptide conjugated PMOs. So there is obviously a large class of this type of therapeutic. As they have come along in their states, there have been successive generations. One of the first modifications was a modification of the phosphate, where the phosphate itself was turned into a phosphoric phosphorosulfonate, and that has led to a lot of prolonged stability within the actual molecule. There's been other sugar modifications. There have been bases added to make them morpholinos. One of the biggest things has been the conjugates that have been added to the end of these strands, such as GalNAcs and lipids and sterols, in order to focus on the delivery of these candidates to the targeted cell sites. So common approaches for bioanalysis are LC-MS-MS using triple quads, hybridization-based LC-FD, liquid chromatography coupled with high-res accurate mass, and hybridization ELISA assays have really kind of come to the market as being the most efficient way of analyzing these compounds. So the LC-MS-MS approach using the triple quads obviously have pros and cons. The pros is they're very selective. You are looking at the mass and a transition of that mass in order to get the selectivity and specificity. So it is a direct measurement of the oligonucleotide. You get much lower LLOQs than UV detection. So it's kind of come to place within the past 15 years as kind of the gold standard in order to get down to the sensitivity needed for these molecules. You are able to detect multiple analytes individually, so you can see the antisense strand, you can see the sense, and the metabolites within a single assay. The sample is extracted so it can be concentrated in order to increase the sensitivity if that is necessary. And they have much faster run times than an LC fluorescence detector or LC UV assay. That was an older approach. The cons is the equipment used to analyze these molecules is more expensive than something doing like an ELISA-based assay or a fluorescence detector-based assay. You do need an internal standard in order to improve the precision of the assay. And the longer the oligonucleotide, you tend to get lower sensitivity, mainly because you're looking at multiple charge envelopes. ESI negative mode typically isn't as sensitive as ESI positive mode. And since most of these molecules have that phosphate backbone, you typically are analyzing in the ESI negative mode. You also need to maintain these equipments. The equipment can be cleaned, it may have to come down, versus the other type of fluorescence detectors in UV don't require as much maintenance. Hybridization-based approach. The pro is it's very sensitive and you can use a small aliquot. Most of our assays range between 20 and 30 microliters. So you don't use a lot of the sample volume and you get better sensitivity than you do on a triple quad or a high-res accurate mass platform. The specificity of the assay will increase with the size of the oligonucleotide. And that's because you're using a PNA, which has a probe on it, a dye. You hybridize that to the antisense strand of the oligonucleotide. So the longer the oligonucleotide, the more specific you can make that PNA, and hence your specificity goes up. It's very rugged because modified oligonucleotides, you usually have the conjugated part on the antisense strand or on the sense strand, which you melt away, and then you hybridize to the antisense strand, which is the therapeutic. Now, if you do happen to have a conjugation on the antisense strand, you still have a rugged assay. You may have to work with the anion exchange on the back end in order just to improve your peak chromatography. Reference standards are available. You can look at separating the N-1, N-2 metabolites on the 3' end. This often leads to a more rugged assay because these are often present in the in vivo samples where we can only see them when fortified in the in vitro samples. The cons are the specificity, although is good when you increase in size, it isn't as good when you're using a triple quad or high-res accurate mass platform. mainly because you are looking at what you've hybridized to the antisense strand rather than a direct measurement of the mass or looking directly at the antisense strand. You do have long run times. This is to enable the separation of those metabolites and equilibration of the anion exchange column. Those longer run times actually lead to longer method development times, not because it necessarily causes more experiments that have to be done, but you're limited to as many experiments that you can get done in a week. Typically, with a mass spec approach, you can look at data the next day versus a fluorescence detector approach. You have to wait a couple days in order to get the data and then move on to the next step. If metabolites are not fully separated in the in vivo samples, you will have some interfering peaks, which you may have to sum together in order to get consistent concentrations across all the samples. Since the LC is anion exchange based, it does not work with positively charged backbones such as like PNAs and PPMOs. If an extraction is necessary in order to increase your sensitivity, there is no internal standard that would track any type of sample-to-sample variances. So looking at the high-res accurate mass approach, the Pro it's very selective, and it's very selective without having to go through a transition. So you don't necessarily have to fragment these oligonucleotides to a daughter ion. You can look at them intact. That being stated, fragmentation is possible if needed in order to improve your signal to noise. The selectivity can be based on the intact, and we do get much lower LLOQs than we do in, say, UV detection. Typically, we're very comfortable with a 30 nanogram per mil LLOQ with like a 25 microliter aliquot. We can get down to 5 with much, doing your method development. Typically, that takes like 100 microliter aliquot. Like other mass spec platforms, we are able to detect the antisense, sense, and other metabolites all in a single injection. And if doing full scan analysis, this is all done in one sweeping data. So the sample is extracted. It can also be concentrated in order to increase the sensitivity if necessary. As stated before, we've got faster run times than FD or UV assays. And with that full scan analysis, you are able to mine the data after it has been generated. So if you want to go back and look at something else that was in the sample, doing full scan enables you to do that without having to go and rerun that sample. Now, a con is the expense of the equipment is more than, say, that of a triple quad. There is a slower cycle time than triple quads, and we'll get into that a little bit later into the talk. You do need an internal standard that improves the precision of the assay. The longer the oligonucleotide, once again, you have lower sensitivity due to those charge envelopes. Same thing, the ESI negative mode isn't as sensitive as the positive mode, but we have seen a better consistency of sensitivity across the high-res accurate mass than we have the triple quads. Once again, you still need to maintain this equipment. So a hybridization ELISA method, the Pro it's a very fast sample prep. You go through a hybridization, that's really it, and then you analyze these samples with a very sweeping. So whereas an LCMS assay typically can be done within 12 to 24 hours, depending on the runtime of 5 to 7 minutes, and depending on how many samples are there, a ELISA assay can be analyzed, in less than 10 minutes. It also works well with modified oligonucleotides. Sensitivity is not impacted by the length of the oligonucleotide because, once again, you are analyzing that hybridized strain that you have put onto the antisense strand. The equipment isn't necessarily as expensive as mass spectrometers, and once again, you have that sensitivity. The con is, once again, you're not as selective as you are with the mass spec. You are measuring something else that you have hybridized to the antisense strand. So you really have to take into faith that you have hybridized and you're measuring what you want to do. You can only detect single strands. You can't detect multiple strands, or there'll be some together. It just depends on what it's hybridized to. Troubleshooting may be a little bit more difficult because of that, and critical reagents may also be necessary. There often is a lower linear range, mainly due to just getting to a quadratic nature of what you're analyzing. So this is a talk that what approach should I take? When people get in contact and we start discussing with them what would be best for their assay, there are a few questions that you really need to pose. One is, typically the more specific your assay is to your compound, the better the data will be for a regulatory submission. When you can go in and obviously identify the fingerprint of what you're analyzing, you can say this is exactly what we're looking at. There is a little bit more confidence in that data. The second is, what is the target range that you're going to need for an accurate PK assessment? If the higher specificity doesn't provide you the PK information, then obviously you're going to have to move that assay into something where you can get that PK information. Also, how important will the analysis of the metabolites be in the program? How much is present for your regulatory submission? With some approaches, you're not going to be able to see them individually, where with other approaches, you can individually identify them. And what type of oligonucleotide are you developing? If it's something that's a positive base, obviously an LC-FD with anion exchange isn't going to work. If it's a longer strand, we may have to look towards hybridization. So these are the questions you really have to ask yourself when deciding how you want to take on bioanalysis. So as you kind of heard, here's a graph to kind of summarize where we are currently. So typically sensitivity goes up as you move towards a hybridization assay and the oligo gets longer. So with a shorter strand, mainly because the specificity is lower, since your base pairing, you can't be as specific, but in LCMS, since it's a smaller molecule and you've got a smaller charge envelope, your sensitivity is going up. So this has just been the general trend that we have seen. As stated, typical LLOQs for mass spec is around 5 to 20 based on your aliquot size, whereas hybridization-based assays is anywhere from 0.5 to 1 nanogram. So really, as we preach, you want the right method for the right purpose. Considerations for your LCMS approach. What instrument do you have? Where do you want to go? How much information do you want to collect in a single injection? You want to consider your chromatography, such as peak shape, oligo retention on the column, and getting separation from the sense strand, the metabolites, and the parent strand. And if anyone has worked in this space, you know that carryover is always something that you need to typically address. Often coming with just not getting full elution when you put a large concentrated sample on column. Ionization. So we always see formation of multiple charge states. What charge states do you want to monitor? Do you want to go to the lower charge states, or are you going to look at the higher charge states? You want to avoid formation of the metal adducts because, once again, that's going to complicate the charge states that you're looking at. And often, if you're in a triple quad approach, it can drive down your sensitivity. Then, if you're looking at high-res accurate mass, you want to look at full scan versus fragmentation. So comparing triple quads versus high-res accurate mass platforms, here are kind of where the pros are with each platform. With the triple quads, we get better sensitivity. The systems are often easier to maintain. In my opinion, the software is a bit more robust, a bit more proven within the triple quad space. And across most of the CROs, they are readily available and very high familiarity with those types of platforms. So there's going to be more people who know how to run those platforms than, say, the high-res accurate mass platforms. But for high-res accurate mass, right, sensitivity is typically adequate for most PK programs. If you're doing a toxicity program, you often don't need that 1 or 5 or 10 nanogram per mil LLOQ. And when we strive for those, often we end up diluting a lot of those samples into the linear range that we have established, and that often leads to less precise information. So once again, you want to look at what range is best for your assay. You collect a lot of data, and a lot of that can be used for downstream analysis. So if something comes up, you say, we analyzed some livers at your shop. Is there ability for us to go in and see what was there? If it was done full scan, we can absolutely provide that service. There isn't necessarily tuning required with regards to identifying the masses if you're doing full scan, because all we got to do is look at a window and we will see a host of those ionized states. And that is because of the larger mass detection window that we're using on those instruments. So a harder look at some of the differences between these two types of platforms. So one, in the triple quad, you can look at this as like a constant ion tunnel. It is basically a freeway of ions running down to a detector. So it enables you to dwell on transitions, so you can look at one transition longer than you would be looking at another transition. And anything that's coming off of the column and focused into Q1 through Q3 is going to provide you with a hit at that detector. Now, that isn't the same thing with a high-res accurate mass platform. I often describe our Orbitrap as kind of a breathing instrument. The trap inhales ions that have been focused in by that front quadrupole mass filter. It then either can go to the orbit mass analyzer, or it can go into the HCD cell where it can be fragmented. If you go to the HCD cell, you will then have to go back to the trap and then to the analyzer. All of this, when it's being done, takes up time in the trap, meaning that your mass filter isn't sending anything into it at that point in time. So you're really inhaling and exhaling, and depending on the analysis, you may be inhaling and exhaling again. So the timing of how all of these components work together comes down to what we call the IT-AGC ratio. So how long is your trap door open? How big is your trap? Really can tie back to the precision of the instrument and how many data points you would get. So although you don't have to tune it directly with regards to your, what fragments are you looking at, you do have to look at that timing and to ensure that you are getting the most out of that sample from injection to injection. So as stated on the previous slide, for the triple quad approach, you can optimize dwell times to improve the sensitivity. But during method development, you should monitor multiple charge states. You may find that certain charge states give you better selectivity, sensitivity than other charge states. If possible, you really do also want to have the metabolites or the N- or the 3' N-1 metabolite present in order to ensure that those charge envelopes from one aren't going to overlap to charge envelopes of the other. You want to consider different ion pairing reagents to drive those charge envelopes. Triethylamine gives you a different charge envelope than diisopropylethylamine, and there are other bases that are used in order to drive those charge pockets around. So here is a look at an 18-mer, this was a DNA, both our triple quads and our Orbitrap. The point of this slide, and this was done with the same mobile phases, same sample, same column, both run on, same LC systems. You can see on the triple quad, the main charge states that we're seeing is the 954, 818, and 7. And this represents typically the -9, -10, and -11 charge states. Whereas on the QE, the major charge envelope was up around 1909. That is the highest abundance of ions that we're seeing on that instrument. Now, the reason for that is because you can't see that high of a charge envelope on the API 5000. It's got a more narrow window in terms of the mass to charge ratio than the QE. A 5000 tops off at 1250. The 4000s actually go much higher than that. They go up to 2500, and the 65s, but you still aren't looking at the same mass to charge ratio as you do with an Orbitrap, because that can go up to 6000 mass to charge ratio. So you do get a wider window on the QE than you do on the triple quads. So when looking at analysis on a high-res accurate mass, and in our case, the Orbitrap, you do have the option to do targeted SIM. So a targeted SIM analysis can help you eliminate noise and improve the signal to noise ratio. It's easier to optimize your IT to AGC ratio because you have a smaller number of ions that are going into the trap. So to optimize that space is easier than a full scan analysis where all the ions within a large window are going into that trap. On the other side, it does drop your overall data points. For every identified mass in your mass inclusion list, so if I've got 3 masses that I'm looking at, I have taken my full scan analysis and divided it by 3. So where I would get in full scan analysis 3 data points for that, in a targeted SIM, I would only get 1. And you also cannot go back and mine the data post-acquisition. Now, you have to balance that. Does the improvement in signal to noise mean I get better data for what I want to look at? It's just always a consideration that you want to take into your thought process. On the other hand, full scan, you get data points for all the masses with every injection. You are able to go back and mine that data, but as spoken before, is a little bit more difficult to optimize that IT to AGC ratio, mainly because you have a lot more ions going into that trap. For chromatographic considerations, you want to take both peak shape and LC retention in, ion pairing, reverse phase versus normal phase. So this has been kind of a hot topic over the past 5-6 years. There are some shops that do the helix approach. The benefit to that is ion pairing, 1, it costs money, and 2, often have to be prepared freshly or within 3 days of analysis in order to maintain that sensitivity. But unfortunately, we just haven't seen the same type of sensitivity with the helix approach. So we still mainly focus in on ion pairing here at Illyri. Formation of multiple charge states. Once again, this comes back to what is the base pair that you're using and what charge state is it going to do. And that directly leads to your ionization efficiency. Metal adduct formation. So we do use chelators within our mobile phase in order to drive down the sodium and metal adducts. And we do concentrate on carryover. We try to limit seesaws on the back end in order to continue to wash the column, because what we have learned is if you inject a large number of highly concentrated samples, the seesaws really just don't work on the end. So you have to focus in on limiting your gradient that you have and trying to go as isocratic as possible. So if you've worked here, you know the ion pairing reagent is coupled typically with a fluorinated alcohol. Why do we add the fluorinated alcohol? So HFIP, which is what we use here at Illyri, helps drive the solvent evaporation process. Oligonucleotides are highly aqueously bound. They are a hydrophilic type of molecule. And in order to drive them to the outside of the droplet, to get that charge to build up on the surface in order to get to the Coulombic explosions to drive the droplets down to where they continue to ionize and get into the source, the fluorinated alcohol helps drive it to the outside of the droplet. Now, too much HFIP can end up lowering your sensitivity, whereas not enough HFIP leads to the same type of observation. So you really need to balance and look at what is the most optimal fluorinated alcohol concentration within your system in order to get the best sensitivity. So getting to the extractions of oligonucleotides, and obviously this is mainly for high-res accurate mass or triple quad approach, mainly due to the ELISA you typically do not extract along with the fluorescence detection type approach. So there are two main ways of looking at this. This the liquid-liquid exchange with phenol chloroform, and then there's solid phase extraction, where there are two main types where phenometric clarity has kind of been the gold standard, but anion exchange has also worked for these type of therapeutics. So for liquid-liquid exchange, the phenol chloroform, which was originally produced to get proteins into the organic layer, but is now being used in order to keep the oligonucleotides in the aqueous layer and drive the proteins away, works very well with like a 25 to 50 microliter aliquot. Unfortunately, the larger the aliquot increases the chance of gelling the samples, which is due to not getting rid of the proteins within that sample. Now, you can go to a larger aliquot, but you're going to get more and more manual in the process as that goes. So we have found we've been able to get 25 to 50 microliters work within a 96 well plate. But larger than that, we end up risking contamination due to the vigorous mixing that we need to do in order to avoid gelling of that sample post-extraction. For automation, you need to ensure that your liquid handler does not penetrate down to where that protein layer forms. There are often three layers associated to this: the aqueous layer, then there's a protein kind of mixed layer, and then the organic layer at the bottom. You don't want to disturb that middle layer. A back extraction of the aqueous layer using methylene chloride also helps with sample cleanup for these liquid-liquid type approach. So for solid phase extraction, really there's a manual put out by Phenomenex. And although we don't necessarily follow that manual step by step, we're very close to it. And almost everyone that I talk to within this part of the industry also knows this type of extraction approach very well. But you're basically aliquoting out the sample. You're adding a buffer. That buffer often has a type of modifier within it in order to keep the association and minimize binding both to the protein and to the equipment that you're using. You load that sample, you're washing that sample with a few steps, and then you're eluting that sample. Now, I can let you know via experience that all steps 1 through 4 need to be done with caution in terms of how fast you load, elute, and wash these samples. You want to ensure that you're capturing the oligonucleotide in step 1. And if you load too quickly, you can often take up those binding sites with proteins rather than oligos. So slower the better. And in step 4, the same thing. You've got to pull it off the sorbent bed and elute them out. So once again, slow as you go in order to improve your recovery. Some things that we have learned taking on this SPE type of approach is The manual, I believe, states 1-to-1, and we have found that, going up to at least 5x of your aliquot to buffer improves both the linearity of your sample and the loading of your sample onto the SPE bed. And specifically for the elution step, we use butyl hydroxylated toluene in order to stabilize the THF. This reduces the amount of oxidation and preserves the phosphorothioate within the sample and keeps it from reducing to the phosphonate. So some precautions as you go along. You do not want to lose your sample during the journey from the sample to the detector. And there are so many places where you can lose an oligonucleotide within that process. It starts right out with just making your solutions, your stock solutions. These compounds are very sticky in nature. They bind to plastics. So we have to take into account surfactants or other types of proteins that we want to put in there in order to not lose them to the container. That being stated, you also can lose them to protein binding. So there are additional buffers that you have to take into consideration, and perhaps even digestion if you're looking at tissues in order to alleviate the binding of the oligonucleotide to those proteins. Once again, you can lose it in your extraction plates if you don't have surfactants or you're using a plate that may attract the oligonucleotide to its surface. You can lose it to the LC system. Oxidation of the phosphorothioate backbone, and obviously recovery losses due to just not getting everything off. So you have to be careful as you go through this process. You want to ensure really you minimize transfers, and at each point of the transfer, you're being cognizant of potential binding to what is being done in that process. So the oxidation of the phosphorothioates. Once again, we use the butylated hydroxytoluene within our THF. We stabilize it, and this just kind of shows the chemistry of what is going on. Before doing this process, we did notice right below our parent strand at N-2 in terms of the mass, we would see an oxidated recovery of the phosphorothioate that had been converted over. So this is just showing the chemistry of what we're trying to avoid in that process. And here is a schematic. So the good news is, since we've taken on this type of preventative approach, I actually had to go back in order to find way back in order to find an example of that oxidated phosphorothioate within our samples. And as you can see, we're below the 10+ strand, we see that oxidated moiety within the sample. So you may see an upward quadratic response within your samples. There are a few things that can lead to this type of, we call banana type quadratic response. One can be a drop in the extracts post-extraction, loss of the oligonucleotide during your sample preparation, and then oxidation. Now, there are different ways to kind of look at to see which one is causing your upward quadratic response. If you're seeing a drop in your extract post-extraction, that upward quadratic response will actually get worse over time. If you're seeing a loss in the oligonucleotide during your preparation, you're going to see a drop in the response per nanogram at those lower concentrations. Once again, just go into your LIMS system, whatever you're using, look at the response per nanogram. You'll see a very consistent response, typically from 8 down to 4, and then you'll see 3, 2, 1 gets lower and lower and lower, where 1 and 2 are almost becoming equivalent. And then oxidation. So if you're seeing it due to oxidation, you'll see that from 8 to 4, you'll end up with kind of the same amount of oxidated species within the sample, and that's due to your hydroxy species, the radical. There's only going to be so much of it present, and it becomes the limiting reagent in that oxidation process. But as you get to the lower concentrations, it's no longer the limiting reagent, and you'll see a higher ratio between the unoxidated and oxidated species within the sample. So for a hybridization-based approach process, this is just kind of showing a cartoon. I think most people are very familiar with this, but here we're showing a small interfering RNA. We're melting them away from each other. We have a PNA probe or an AutoProbe. They hybridize to each other versus, using the Watson-Crick-based pairing. And then we're using anion exchange on the back end in order to separate out those species. So here is a chromatogram. This is where we were able to separate the N-1, N-2, N-3 metabolites. We could do that because we had them in vitro. And then the parent is eluting at 7.83, whereas the metabolites are 7.5 and 7.1. So ELISA-based assays, once again, a very robust type of method. Although it doesn't have the specificity, it does have the sensitivity that are needed for some of these types of programs. Typical LOQs are now getting down to about 100 picograms. It's very simple and straightforward. The disadvantage is the hybridization-based approach is going to give you a detection or light, whether it's a metabolite or not, because the sandwich type complex is going to anneal to both. So the specificity does increase with larger because you can make the larger type of sandwich complex or your capture probe, but you're still going to end up catching those metabolites. Now, there is an ELISA-based approach that may limit the amount of metabolites that you're detecting within your sample, and that is the ligation assay. And the reason for that is it requires the 3' hydroxyl end to be accessible for ligation to the detection probe. So in those metabolites, those aren't usually accessible. So you end up seeing mainly your sample as is, and you reduce the amount of interference from those metabolites. So overall, where would we like to go overall within, bioanalysis of oligonucleotides? We would love our sensitivity to go up, independent of the length of the oligonucleotide. And we would love the specificity to go up. So, although we don't have the answer to all of those yet, we have started working on some of them. So one is the specificity and selectivity, and we can really kind of hammer into the LC-MS approach. The extractions can be based on less of the charge of the molecule and more on the structure of the molecule. So instead of going after the negative or positive nature of these compounds, let's use a hybridization type approach where we can look specifically at the sequences we want to pull out of the sample. We would like to get simpler LC conditions. Ion pairing is necessary at this point in time, but perhaps the approach to ion pairing can be modified so we get longer stability of those solvents and we don't have to go and make them on a day-to-day basis. The reduction of multiple charge states, if we can concentrate into 1 or 2 charge states rather than distributing a charge envelope over even 10 charge states, that's going to improve the sensitivity of the compound. More and more bioinert consumables and instrumentation is coming onto the market. There has been a large focus into being able to use more bioinert needles and non-absorption type plates in order to limit that recovery as we spoke about earlier in the talk. And then obviously increased sensitivity in mass spectrometers. As we develop more higher resolution and better quadrupoles, that sensitivity is going to increase over time. So just in the past couple years, this has been a focus that we've wanted to do here at our shop, and improving the extraction specificity and selectivity, instead of focusing in on an SPE approach, taking something that we do more towards proteins and applying it towards oligonucleotides. So we can take that stripped avidin biotinylated that's been used for, capturing antibodies, and we can do the same thing with oligonucleotides. All we have to do is come up with that biotinylated capture probe, in essence, somewhat of a sense strand. We outcompete the sense strand that may be there in a small interfering RNA, and in an ASO, we don't even have to do that. We can then capture that on that bead and then isolate the bead and then melt the target ASO away. In this type of process, we can go in and we can pull out exactly what we want based on its sequence, rather than pulling out a host of things based on the charge. And in this case, for an internal standard, maybe this is the new approach to a stable label, because as long as the internal standard can be made where you have extra base pairs at the 5' end, you're going to be pulling both the antisense strand, that's the therapeutic, and then the additional internal standard out with the exact same process. Now, obviously not a stable label in nature, but once a compound gets to a certain size, what does the addition of a few bases really going to afford back onto that? So this is one focus that we're taking into the lab in order to improve the specificity and selectivity of our extraction process. So here are references that I've used. Obviously, there's been a lot of science done in this space. There's been a lot of great research that's done, and we want to recognize all of those people that have contributed to the growth of what we do on a day-to-day basis. I also want to thank, obviously, Illyri and the opportunity to talk with everyone today. And now we'll take any questions that you may have.
That's great. Thank you very much, Dr. Voker, for that very insightful presentation. We are indeed going to now move to our Q&A session. And I've already received some questions from our audience members, but please do continue sending in your questions, and we will definitely try to attend to them during the Q&A session. All right, so as I did mention, we do have a few questions here already, and we can begin with those. Dr. Voker? Are you ready?
I am.
All right, great. I don't know if you want to join me via your webcam, and so we can get started.
Yes.
All right. All right, there you are. Wonderful. Okay, so the first question that we have here is, are there other fluorinated alcohols used for ion pairing besides HFIP?
So there are. I would say HFIP has kind of been the gold standard up to this point in time, but there's also HFM IP, so hexafluoridated methyl isopropanol. If you look back into the reference section, there is an article actually that talks about a lot of fluorinated alcohols that have been investigated, and all have some pluses and minuses as you go along. We do concentrate on HFIP because we do a lot of oligo analysis, and in order to ensure our instrumentation do not have to be changed over and over and over again, that's been our main focus. But yeah, there are other fluorinated alcohols that could be used in this process.
Great, thank you very much for that answer. another question that we have here is, with regards to a bioanalytical workflow, what are the major differences between ASOs, siRNAs, and PPMOs with how you approach bioanalysis?
So, they all three, although, the approach in terms of what they're trying to do is the same, have a vast difference in terms of how you're going to extract and detect them. Between siRNA and ASOs, I mean, the main thing is the ASO doesn't have a sense strand that's annealed to it. So the conjugations may be directly on the ASO. There's typically more phosphorothionate within the ASO, so you have to worry a bit more about oxidation of that sample than you do in small interfering RNA. Now in siRNA, obviously you have the sense strand also, so it's whether or not you want to look at both sense strand and anti-sense strand concentrations. But for the most part, I can tell our sponsors do not look at sense strand concentrations. But that sense strand, since it is typically conjugated to something, often can change the extraction approach of the sample. And as you get into PPMOs and PNAs even, you're looking at a positive versus a negative charged backbone. So the extraction process and the chromatography process is vastly different than the approach that you would take for ASO or siRNA.
Okay. Another question we have here is, what is the biggest challenge you have when developing oligonucleotides methods?
So there are a lot of challenges there. The biggest one typically is sensitivity, and that's often related to the clinical programs. With preclinical, we usually don't have that challenge, mainly because the dosing level for toxicity and whatnot is very high, so that lower sensitivity isn't required. But as we move into clinical samples and the dosing gets lower and lower, in order to get the PK profile, we often have to drive down the LLOQ. And at this point, the instrumentation just hasn't kept up with the necessity for those LLOQs for a mass spec type approach. Now, other challenges, as we have talked about, is just even making your stock solutions and ensuring that you're not losing that sample as you go through the process. So looking at surfactants, what's the best surfactant? You've got chaps, tween, some may provide benefit, but others may provide benefit, but yet suppression. So it's really going through and balancing what you are getting out of it in terms of a positive manner and what impact is it doing towards your analysis.
The next question that we have here is, what techniques are used to confirm the sequence of oligonucleotides?
So that's getting more into the CMC type space. They do top-down type approach, where you can go into fragmentation and then picking up the pieces. That comes more into the software side of it. Something like TraceFinder will benefit you there. We don't do sequencing necessarily in our lab, so I'm not as experienced with doing that type of approach, but it does follow a bit of what you do with peptide analysis. Now, you're not necessarily going to be able to do this on a triple quad as well as you are like an Orbitrap or a TOP, but it often is that top-down approach that leads to figuring out what type of sequence you have.
Thank you very much. Let's look at the next question, and this is, are you using the Clarity OTX extraction for PPMO and PNA, or is there a different extraction you have found to work best?
So we have tried the Clarity approach for those compounds. We haven't had as much success as we have with anion exchange, quite honestly, which was surprising because before we thought the cation exchange would give us the best recovery, but we have continued to see better recoveries with anion exchange. Now, we're still going back and investigating that. We're taking a harder look at maybe there's something else that's proving to interfere with the cation exchange. But anion exchange has been the #1 approach that we've used there versus the clarity.
All right, I think we have time to squeeze in one more question, and this is, what were the most significant modifications to the sample prep and analytical methods for LC-MS that yielded the most improvements in sensitivity?
So one of the things was the use of the BHT stabilized THF. That really dropped down the oxidative process that we were seeing prior to using that. The second was increasing the amount of buffer within the sample at the sample prep stage. So we were often 1-to-1, and since we've gone up to at least 5-to-1, that has also improved the recovery. Looking at breakthrough has been very important in terms of not taking the clarity approach, but looking at other types of SPEs in order to dial in both your load, wash, and elute, because inherently everyone wants to think 100% aqueous or 100% organic is often going to be the best mix, when usually they are not. It's usually a hybrid between that leads to your highest recovery of the sample. And really focusing in on carryover and peak shape has led to better analysis at our shop. We don't have to add in as many blanks, so we get more samples into the plate. Our column life has been higher because we're not leaving sample onto the column. And now that, walking or talking through this, even the instrumentation. So when we finish analysis, we always put our instruments into a low flow. So there's always mobile phase running through our sample, our auto samplers. We keep it at like typically 50 microliters per minute. And we have noted that that minimizes the aggregation that we see in those systems post-analysis. Prior to that, we ended up chasing clogs around our auto samplers. The clog would run through it. We'd get high pressure. Since we've kind of put that process in place, that has really minimized the amount of maintenance that we've had to do on the auto samplers post-analysis.
Wonderful. That brings us to the end of the Q&A session. Thank you very much once again, Dr. Boker, for that insightful presentation and for answering all of the questions in the Q&A session. If we couldn't attend to your questions, the team at Illyri may follow up with you, or if you have any further questions, you may address them to the email address displayed on your screen. Thank you everyone for participating in today's webinar. You will be receiving a follow-up email from X-Talks with access to the recorded archive for this event. A survey window will be popping up on your screen. Your participation is appreciated as it will help us to improve our webinars. Now, I'm about to send you a link in your chat box where you will be able to view the recording of this event. You can also share this link with your colleagues so that when they register, they can also view the recording there as well. So I do encourage you to do so. Now, once again, please join me in thanking our speaker for today, Dr. Troy Boker. We hope you found this webinar informative. On behalf of the team here at X-Talks, thank you once again and have a great day, everyone.